Hello, North Zone employees. It's time for another fun little review, and this one's going to be on triage tags. So you've probably seen the massive pile of these triage tags in the front console of your rigs, briefly had a little what if thought, and then probably never thought of them ever again until the next unit check. And the cycle continues. Triage tags are probably one of those things that you learned about in school and then filed away in the back of your mind to make room for more important things. But they are also one of those things that you will really appreciate knowing how to use when needed. So let's do a quick little review. Before we get right into the thick of it, I would like to make the disclaimer that because these tags are used so rarely, it's possible that not all of the stations have the exact same tags. If you do happen to have a different version of triage tags on your trucks, it would still be a good idea to follow along and then send me a picture of the tags on your truck. Chances are a lot of the information in this video will pertain to most triage tags. They all generally ask for the same information. So these are your triage tags in question. Now, the purpose of these simplified tags are to mitigate any possible language barriers between rescuers and emergency personnel on an MCI, which is great in theory until you are trying to accomplish rapid triage and have no idea what the pictures are supposed to mean. We are going to be doing a quick review of what all the sections in these tags are for and how to properly use a triage tag in an MCI. So let's get this started. The first section on the front of the triage tags is for the time and date of your triage. The time is going to be a very important piece of information to include on your patient's triage tag, as this is going to help indicate to other rescuers how quickly your patient has improved or declined. It will also help drive decisions regarding reassessment of that patient and whether or not they need to be the priority at that time. The next section, of course, gets immediately confusing, being that these are the generally accepted icons for gender. In actuality, this section is asking for the patient's name. If you wanted to, I'm sure this would also be an appropriate spot to indicate your patient's gender if available. After that, we're going to move down to the street address of the patient. Given this is not always the most convenient time to gather this kind of information, and it may not initially be your priority. If you choose to leave this blank after your first assessment of the patient, please be sure to return to that patient when time allows and fill this in. This also goes for the following line, which indicates the patient's city, province, and postal code. Next, we're going to be tackling the pertinent medical information and observation section. There is plenty of space given here, and for good reason. This space should be used for information such as a pertinent past medical history, medications, allergies, as well as pertinent observations from your initial assessment of this patient. The last section on the front portion of our triage tags is unfortunately not shown in this version, but it's arguably one of the more important sections on a triage tag. Located at the bottom of the observation section, there will be a line indicated with an X. This is where you will need to clearly print out your name as the triage personnel that has performed this assessment and filled out this tag. I say this is arguably one of the more important sections on a triage tag because anyone who has attended an MCI will tell you that if you're not careful, chaos is going to end up leading your scene. This line identifying rescuers that have previously assessed this patient creates a continuity in care and information and a source to back check for possible changes in patient condition. So please be sure to legibly fill this section in. The back portion of the triage tag is more assessment and treatment oriented. The pictures also speak more for themselves here, but we're going to do a quick review. So the diagram of the human body is one that we're used to seeing on our PCRs, and it's pretty self-explanatory. Indicate any areas where the patient has an injury, and if space allows, indicate any treatment given for that injury. This could be a pressure bandage, a splint, ice pack, etc. If you find yourself needing to place a tourniquet on a deadly bleed, this is imperative to note in as many areas as possible, including the triage and the tourniquet itself. Also remember that it is very important to document the time that a tourniquet is placed, and this would be the perfect place to do that. The chart below is for documentation of vitals. From top to bottom, you will be indicating the time, patient's blood pressure, pulse rate, and resp rate. Again, please be sure to document the time for reassessment purposes. The bottom section is reserved for any medicinal treatments the patient may have immediately needed to improve their status. In the case of an MCI, this could be TXA, it could be narcotic pain relief. There are two sections, the left side being IV medications and the right side being IM medications. As always, please do not forget to indicate the time the medication was given to the patient. You may have noticed that the top corners of the triage tags are perforated and detachable. These have many different uses in an MCI if you use them appropriately. The barcode shown on each corner matches the barcode on the tag that will remain with your patient. The detachable tags can be used to mark ownership of anything from loose belongings, clothing, severed limbs, or even the area where the patient was found. Keep in mind that these detachable tags do not come with adhesive or their own string, so you should have a plan in place for how you are going to make sure that tag is going to stay where you put it. I think it would also be a good idea to quickly note on the detachable tag what exactly you're marking, just in case the tag is knocked loose. And lastly, we have our triage scores. We're going to go over the commonly accepted triage methods, but for now, I just want to talk about these perforated tabs. Many of us were taught to rip off the tabs to indicate what our patient has triaged as. For example, if I have triaged my patient to be red, then I would detach both the green and yellow tabs. This wouldn't be wrong. However, I have also seen suggestions that rescuers use paper clips to fold up tabs in case of a change in triage status, which is probably not the worst idea, but not the be-all end-all either. So there you have it. There are your triage tags. Now, how are they relevant to you in terms of protocols, and how do you determine what your patient triages as? Shared Health has conveniently prepared a mass casualty triage care map, which can be found in the reference section of your ERS care maps. I don't plan on going heavily into this because you can just pull up the care map yourself, but I did want to take this time to address a typo on this care map. So when you're speaking about the two different triage systems, you're going to be choosing the appropriate one based on your patient's age. Your options are going to be either the START system, also known as the Simple Triage and Rapid Treatment System, or the Jumpstart Triage System for children under the age of 10. Jumpstart is also used on children of an unknown age, appearing to be pre-puberty. They are laid out in a very easy to follow flow chart system that will determine what level your patient is triaging at. The typo that I had mentioned earlier, I believe that your care map lists both triage systems as being relevant to children under the age of 10, which we know is not correct, and now we have touched on it. And then what? So your red patients are going to be your highest priority patients. These are going to be the patients that get a quick head to toe look, and based off of that, a rapid primary trauma assessment. Correct any life-threatening issues or injuries as quickly as possible. For example, open a patient's airway and suction, place O2, put pressure on a deadly bleed, your ABCDE. These patients will take priority for extrication, treatment, and transport to an appropriate facility. Your amber patients are of intermediate priority and will still receive an urgent primary trauma assessment. If any life-threatening issues are found, this patient will become a red patient. If no life-threatening issues are found, promptly treat any urgent issues and transport urgently as soon as resources allow. We're obviously going to transport those red patients first. Your green patients are often referred to as the walking wounded. I find this to be a bit of a generalization and would encourage everyone to critically think when it comes to patient presentation. We all know that the human body can be amazing and can compensate, even if briefly. Having the ability to walk does not necessarily mean the absence of a critical or catastrophic injury. Green triage also does not mean set it and forget it. Every effort should be made to promptly assess these patients when resources allow. And all green patients should be encouraged to seek assessment at a healthcare facility. And lastly, we have our triage black patients. They are considered lowest priority for treatment and transport. And this can feel a little bit wrong as we often prioritize a deceased or dying patient at a high level and emergently transport if indicated. This is not applicable in an MCI situation, and resources have to be allocated to patients who can actually benefit from them. Patients that are triaged as black are either already deceased or not expected to survive. So now that you have triaged your patient appropriately, filled out the tag, provided any urgently needed interventions, and placed them in any established triage zones, your patient's triage tag needs to be left with them while you move on to the next triage. This does not mean that we hand the triage tag to our patient and ask them to hold on to it. The included string on the MET tags makes the obvious placement around your patient's neck like a necklace. Make every effort to make this tag visible and readable for other rescuers. You will not be the only one referring to this tag during an MCI. Now that we have reviewed triage and the use of triage tags, I of course need to mention that much of this information can be found in your shared healthcare maps under Section H or References. This also means that it is available in the Triple P app for areas with little cell service under the condition that you have updated the Triple P app recently to reflect any changes. From an operational perspective, there are a few things that we ask staff to remember to do when responding to an MCI. Firstly, when you are dispatched to a potential MCI, please notify your OCM immediately. This can get the ball rolling for any additional resources you may need, like geoposts, extra trucks, staff. Your OCM can also be available via Fleet for any additional requests. If you arrive at a scene and determine that this is not actually an MCI, which we all know can happen, you can notify OCM of this change of status and to stand down additional resources. But I think when you are dispatched to a potential MCI, you'd rather have it and not need it. We are also going to ask that you familiarize yourself with the process for requesting an interagency channel with MTCC. This can simplify communications with other agencies present on the scene of an MCI. So as a nice bonus resource, I was able to find this informational flyer that is specific to the MET tags if you're ever looking to refresh your memory again. These are going to be saved onto the shared drive under EMS, paramedics, education, and assessment. Obviously, this video will also be available if you're ever feeling like you would like a little refresher, and please contact your clinical team if you have any questions. Thank you so much, everyone, for taking time out of your day to watch and educate yourselves. Thank you.